You're listening to Health Professional Radio. My name is Wayne Bucklar, and joining me in conversation today is Dr. Melissa Stoneham. Melissa is the Western Australian Director at the Public Health Advocacy Institute, and she's joining us today to talk about, a really interesting topic, I think. It's about, or triggered by what's happened recently with the National Basketball League. They've announced Hungry Jack's as a naming rights partner, and Melissa has a view about it, and I'm keen to hear it. Melissa, welcome to the program.
Good morning, Wayne. How are you doing?
I'm really well, thank you. Now tell us why this is concerning you.
Well, there's a number of concerns we have, but to put it very simply, when a sponsor such as Hungry Jack's, which their main business is to sell fast food, and that's quite an unhealthy option for people, when they start to sponsor teams like the NBL, so all their basketball teams, which have a huge audience both at the games and through media, they're basically walking billboards for fast food companies, and that really does start to normalise the fact that it's okay for people to eat fast food as part of their daily habits. So we're very concerned about that. But we also know that children are a major target for advertisers, and kids also influence their parents' spending. So sponsorship of sport really does offer sport companies a way to expose kids to their brand and foster this connection between kids and the loyalty to their brand. So they're really looking at getting young people to be very loyal to brands so that they will grow up with those brands as they get older and older. And we've done some research on this. We did a study of kids aged between 5 and 12, and we found that most of them could associate their team sports with the products and the messages that are promoted through the sports. And a lot of the kids think that the food and drink companies that sponsor their clubs or their favourite teams are cool. So if kids are starting to think that this is a good thing, they'll probably be more likely to go out and purchase the food. And we don't mind kids eating junk food every so often, but if it's something they're going to do on a regular basis, then that's when we're starting to have concerns.
Now, in fairness to the National Basketball League, this is not unique to them, but you mentioned drinks as well, and I presume it's sugar that's triggering the difficulty there.
Well, actually, it's interesting you say that. Sugary drinks is one issue, but we also looked at fast food, gambling and alcohol sponsors of sporting teams throughout mostly Western Australia, but also some. We looked at the National AFL League to find out what sort of sponsorship the national football clubs were having. So we've got all that information, and I can certainly tell you who topped the ladder of unhealthy sponsorship in both the national and the West Australian football clubs. If you're interested in that, if you want me to name and shame, I'm happy to do that. We also looked at state of origin because, as you know, rugby league, especially over in the eastern states, is a big event, and I think that there's at least 4 million people that watch that series. So as you can see, the more sponsorship companies can have on signage at the fields and on uniforms, the better exposure they'll have to a wider audience.
Now, I'm old enough to remember the days when all of these teams were sponsored by tobacco companies, and that slowly over a number of years, got ruled out and then became illegal. Is that the extent to which you'd like to see a community response to unhealthy food?
Yes, we'd like alcohol to be the next cab off the rank to go from alcohol and sport shouldn't mix. And yes, fast food and gambling are the other two unhealthy activities that we would like to see taken away from sport, so that sport is then seen as a healthy activity with no mixed messages in the sport at all. So yes, I can say that tobacco's gone, alcohol should be next, followed closely by gambling and fast food.
Do you see the concern that the sporting teams have about being able to monetize their activities with limited sponsorship? Should those things be banned?
I absolutely understand that this is an economic factor for many of the sports clubs, and that they do rely on these sponsors for huge amounts of finance that sponsor and promote their activity. But when we looked at our research, let's just take one of our West Australian studies. We looked at 61 clubs, and 29 of those had at least one unhealthy sponsor. So That means that there's quite a number of clubs out there who have sponsors that are either neutral or healthy. So there are plenty of other options for clubs to pursue. So things like banks, gyms, healthy products such as, fruit and veg. For example, Coles is now sponsoring Little Athletics. So, it's sort of a neutral brand. But there are lots of other options out there. And I think it's timely for administrators of sporting clubs to really think about whether they want these unhealthy messages being portrayed through their healthy sport. Because basically what sport does is it encourages people to get out of the house, to run around, use up some energy, feel good about themselves, increase their mental health. And the last thing we want for them to do after they've played a great game of sport is to go and have a burger or a sugary drink. So we would prefer that they try to get these unhealthy messages away from sport so that it can go back to it being a completely healthy thing, an active and normal thing for people to be doing.
Now, Melissa, in Western Australia, you don't have the pokey clubs that the East Coast has, but many of the same organisations that are fielding sporting teams at a national level are also operating large pokey venues. How do these fit together for you?
So over in the East, the pokies are a major source of revenue for the football clubs. We still have issues with online betting, like Tab and Ladbrokes. So that, as you would have seen through the AFL final recently, along the bottom of the screen and during the breaks, there's all of those promotions of gambling. And we've had a number of parents actually contact us after the AFL grand final saying that it was terrible. Their kids are actually picking up on these the odds betting and saying, how does this work, Mum? How can I get involved in this? And so a lot of the parents said that after Macklemore, for example, sang at the rugby league final and after the Killers sang at the AFL final, they turned it off because they didn't want their kids being exposed to the gambling ads. And of course we have the loophole in legislation which says that during any live sports telecast you can still promote alcohol. So during the breaks we still have these alcohol ads playing at times when children are watching sport. And in Western Australia, where we're in a different time zone, so we're 2 or 3 hours earlier than the East Coast, these matches are being played at like 5:30 in the evening. So, of course, our children are still up watching these shows. So there are a lot of issues that we need to be aware of in relation to unhealthy sponsorship of sport. But our main concern is the exposure of kids to these unhealthy messages that are constantly bombarding them. And we think, and research shows, that the more they're exposed to these messages, the more likely they are to actually change their behaviour towards the consumption of unhealthy products.
Well, it's an interesting topic to come up, and as you say, you have the research to support it. It will be interesting to see whether the sporting bodies respond or if there are sponsorship outlets that respond. Melissa, how can people get in touch with you if they're interested to talk to you?
We would love to talk to anyone who's interested in this issue on either side of the fence because it's always great for us to talk to industry as well. And so they can contact us at our website on www.phaiwa.org.au.
Melissa, for those people who are slow to pick up their pencils, what was that website again?
It was www.phaiwa.org.au.
Melissa, thanks for being with us today. It's been a pleasure having you with us.
Thank you, Wayne.
You've been listening to my conversation with Dr. Melissa Stoneham, the Western Australian Director at the Public Health Advocacy Institute. And the good news is, if you've missed my conversation, we have a transcript on our website, and you can also access the audio archive on SoundCloud, YouTube, and iTunes. You're listening to Health Professional Radio. My name is Wayne Bucklar.